So good day everyone. Today I am going to discuss the functional neurological symptom disorder, which is still under somatic symptoms and related disorder. So for the topic outline, what is functional neurological symptom disorder? Its diagnostic criteria, decoding note, brief history, comorbidity, epidemiology, etiology, and under this are the psychodynamic perspective, social and cultural factors, and the treatment. So for the intended learning outcomes, to know the functional neurological symptom disorder, to understand its brief history, to describe its epidemiology, to understand its comorbidity, and to describe the etiology of functional neurological symptom disorder, and to determine its treatment. So this is the first picture. I can't see, my eyes are totally fine, but I don't want to see any more murder, so I get myself. So actually, perhaps the most fascinating of the somatoform disorders is the conversion disorder, in which serious neurological symptoms such as paralysis, loss of sensation, or blindness suddenly occur with no known biological cause. So moving on, let's move on to its background, the background of functional neurological symptom disorder. So, conversion disorder is previously referred to as conversion hysteria and later as conversion reaction. Is classified by DSM-5 as a somatoform disorder and by ICD-10 as a dissociative disorder. The newer term is functional neurological symptom disorder was introduced as a subtitle in DSM-5, a change representative of the shift away from dynamic and towards descriptive definitions of mental disorder. So in DSM-5, the term functional neurological symptom disorder was added in parentheses and after the DSM-4 term conversion disorder. So the terms are reversed, so the conversion disorder is in the parentheses. So in DSM-5 TR, ang ang tawag din sa kanya is functional neurological symptom disorder and yung sa loob naman ng parenthesis is the conversion disorder. So there are actually reasons kung bakit siya change, and this is according to American Psychological Association. The rationale for change is first, functional neurological symptom disorder is the term of choice sa mga international research. And then second, functional neurological symptom disorder or FSND, the conversion disorder is falling from use by researchers and clinicians in the field. And the conversion disorder is not an etiologically neutral term. That's why they prefer to use functional neurological symptom disorder. So, what is functional neurological symptom disorder? So first, I will discuss the F, functional. It means something in us is disturbed in its function rather than its structure. So for example, kapag ang computer ay di na nag-function, the distinction can be made from a hardware problem or software problem. So example of this is if we experience weakness in our legs, it feels like parang na-block siya or na-paralyze. So, due to functional neurological disorder, it is the function or the control of the leg that is impaired. So, just like a computer, ang leg natin has a dysfunction. So, the leg itself with its muscle, the nerves, and the bones is healthy in structure. So, wala kang mga broken bones inside like that. And it's very healthy. So the brain is also intact and your brain is good also, but does not seem properly wired, and thus the communication between the brain and your leg does not function correctly, or um, they didn't coordinate with each other. So may problema doon sa pag-function niya and not sa ang tawag nito, anatomical structure ng leg. Kaya siya functional disorder, and ito yung dahilan na ang mga medical tests or brain scan sa mga taong may FNSD ay normal siya. So next is neurological. Neurological means something to do with the nervous system, in particular with our brain. Since alam naman natin na ang brain talaga ang may control center of our every thoughts, our feelings, and actions. So ang brain natin is merong different regions and different functions. For example, ang motor cortex natin na kung saan ito ang responsible for our movements, and ang limbic system naman is responsible for our emotions. So magkaibang region, but this region of the brain are closely connected, or they interlink with each other. So they communicate and influence with each other. So the connection between these regions are also influenced sa ating mga experiences. So kapag nagka-problema or may mga disturbances na nag-occur sa atin, the communication between those regions such as the motor cortex and the limbic system sa ating brain can become impaired and will lead to functional problem. So the functional disorder can present different symptoms which are divided into two main groups. So ito ang functional seizures and disturbance of movement or sensory sensitivity. So ang functional seizures is that in the brain, similar siya sa computer pa rin or sa cellphone mo na na-crash ang system niya, and because of that, kaya siya na-restart. So, there are internal or external na nag-lead sa software error na yon. Therefore, need mo siya i-reboot. Parang ganun din yun siya sa functional seizures. And then dito sa disturbance of movement, this presents as tremor or paralysis or numbness in one or more parts of your body. So, ang symptoms is pwede din na may pain siya na dala. And then, now, the functional neurological disorder are common. Nevertheless, mga patients na nakaka-experience ng ganitong disorder feels like hindi sila maiintindihan, and that dahil dyan, feeling nila they feel helpless kasi nga ang problem nila is very too hard to understand. So moving on, what is functional neurological symptom disorder? It is known as conversion disorder since the symptoms happen because your brain converts the effects of a mental health issue into disruptions of your brain or your nervous system. So the symptoms are real that don't match up with recognized brain-related conditions. So it is also a mental issue that disrupts how a brain works. And it is a condition in which a person experiences physical and sensory problems. So, parang makaka-experience ng blindness or paralysis or numbness ang isang taong may FNSD that affects the nervous system that cannot solely explained by physical illness or injury. And usually, the functional neurological symptom disorder usually begins suddenly after a period of emotional or physical distress or any psychological conflict. Now, it's important to know na itong functional neurological symptom disorder is a real mental health condition, and it's not faking or just a parang attention seeking lang siya. It is just something in a person's head or that they've imagined. While it's a mental health condition, the physical symptoms are still real. So a person with FNSD can control the symptom just by trying or thinking about it. So next is an illness of symptoms or deficits affecting voluntary motor or sensory functions, suggesting another medical condition but judged due to psychological factors because of preceding conflicts or other stressors. A disturbance of bodily function not conforming to current concepts of neurological anatomy and physiology, characterized by the presence of one or more neurological symptoms unexplained by a known neurological or medical disorder. So, FNSD typically occurring in a setting of stress and producing considerable dysfunction. So, the term conversion, since conversion man ang tawag nito from before DSM-5-TR, it has its origin in Freud's doctrine that anxiety is converted into physical symptoms, since Freud hypothesized that the occurrence of certain symptoms are not explained by organic diseases. It reflects unconscious conflicts. Now, moving on sa kanyang diagnostic criteria, A. One or more symptoms of altered voluntary motor or sensory function. B. Clinical findings provide evidence of incompatibility between the symptoms and recognize neurological or medical conditions. So, sensory or motor symptoms begin suddenly, such as pagkawala ng vision mo or paralysis. The symptoms suggest that an illness related to neurological damage, but medical tests indicate that the bodily organ and nervous systems are fine. So, yun nga ang sabi ko kanina na kapag ang mga nakaka-experience nito ay parang feeling maka-experience sila ng numbness or mga physical problems. Pero kapag i-test sila based sa kanilang medical tests, is fine naman daw ang kanilang nervous system. Then people may experience partial or complete paralysis of arms or legs, seizures and coordination disturbances, a sensation of prickling, tingling or creeping in sa kanilang skin, and then insensitivity to pain or anesthesia, and also the loss of sensation. So, the symptom or deficit is not better explained by another medical or mental disorder. The symptom of deficit causes clinically significant distress or impairment in social, occupational, or other important areas of functioning or warrants medical evaluation. So, ang vision may be seriously impaired. The person may become partially or completely blind, in which the visual field is constricted as if the person were wearing through a tube. So, ang tawag sa loss of the voice is aphonia, and anosmia naman is the loss of sense of smell, which are also a symptoms of functional neurological symptom disorder. So, some people with this disorder seem complacent or even serene and are not particularly eager to part with their symptoms and do not connect their symptoms with their stressful situations. So, moving on to its coding note, ICD-10-CM, or the International Classification of Diseases, 10th revision, clinical modification code depends on the symptom type, with weakness or paralysis, with abnormal movement, with swallowing symptoms, with speech symptoms, with attacks or seizures, with anesthesia or sensory loss, with special sensory symptoms, and with mixed emotion. So to specify it, acute episode siya kapag ang symptom is present for less than 6 months and persistent naman kapag ang symptoms is occurring for 6 months or more. So, for its brief history, the conversion disorder has a long history dating back to the earliest writings on mental disorder. So hysteria was the term originally used to describe the disorder, which the Greek physician Hippocrates considered to be an affliction limited to women and brought on by the wandering of the uterus through the body. So I guess you are familiar with the wandering uterus. Then the Greek word hysteria means womb. So the wandering uterus symbolizes the longing of a woman's body for the production of a child. So the term conversion originated with Sigmund Freud, who thought that anxiety and psychological conflict were converted into physical symptoms. So may clinical case itong si Anna O, which made Sigmund Freud to believe na ang anxiety and psychological conflict ng isang tao were converted into physical symptoms, kaya ang tao is nakaka-experience sila ng paralysis, ng numbness. So ang initial ang I mean ang clinical case ni Anna is that si Anna was sitting at the bedside of her father na may sakit, and she dropped off into waking dream. Then sa kanyang dream, she saw a black snake come toward sa kanyang father na may sakit para kagatin siya. So she tried to ward it away. I-try niya na palisin yung snake sa father niya. And then but her arm had gone to sleep. When she looked at her hand, her finger seems to turn into little snakes. So the next day, when she looked at her hand, her fingers seemed to turn into little snake. And the next day, when a bent branch recalled her hallucination of the snake, her right arm became rigidly extended. So after that, whenever some object revived her hallucination that time, her arm responded in the same way. So parang ini-extend niya yung arm niya kapag ma-remind siya sa mga snake na nakita niya sa dream niya. So later on, her symptoms extended to paralysis and anesthesia of her entire right side. So moving on to its comorbidity, anxiety disorders, especially panic disorders and depressive disorders, commonly co-occur with functional neurological symptom disorder. Somatic symptom disorder may occur as well. Personality disorder are more common in individuals with functional neurological symptom disorder than in general population. So moving on to its epidemiology, 8,000 new diagnoses are made per year in UK, and 50,000 to 100,000 have it in the community. So sa sex naman, mostly ang mga babae ang mas maapektuhan sa disorder na to, and proportion of men increases as age onset increases. And sa children naman, 0 to 9 years old are rare to have functional neurological symptom disorder. And mostly, ang disorder na ito occurs with 10 to 80 years old. Yes, that's it. So, to its etiology, going back sa epidemiology, ang symptoms of conversion disorder daw usually develop in adolescence or early adulthood, typically after major life stressor. So, ang episode nito may end abruptly, but sooner or later bumabalik na naman yung disorder na yon, either in its original form or with a different symptom. For example, dumating siya na nakaka-experience ka ng loss of vision, and then kapag mawala na siya, then later on bumabalik na naman siya with another symptom na naman. And then the prevalence of conversion disorder is less than 1%, and more women than men are given the diagnosis. So moving on to etiology, the cause of functional neurological disorder is unknown. The condition may be triggered by a neurological disorder or by a reaction to stress or psychological or physical trauma, but that's not always the case. Functional neurologic disorder is related to how the brain functions rather than damage to the brain structure, such as from a stroke, infection, or injury. So the physical symptoms may come about as a way to try and resolve or or relieve whatever is causing the extreme mental stress. For example, ang police officer or a soldier who experiences mental trauma from the thought of shooting and possibly killing someone may have paralysis in his hands. Or for example, ang isang babae ay nagkaroon ng mental trauma sa idea, nakakanta siya sa maraming tao, may experience a loss of mawalan siya ng boses, parang ganun. Excuse me. So moving on to its etiology pa rin, but psychodynamic perspective. Freud and his colleague Joseph Breuer developed a psychoanalytic model of conversion disorder by drawing on cases like that of Anna O. They proposed that a conversion disorder results when a person experiences an emotionally overwhelming event, but the emotion is not expressed and the memory of the event is cut off from consciousness. So a more recent way to understand conversion disorder is that there is a disruption in the normal function of consciousness such that the person fails to have an explicit awareness of sensory and motor information. So recent psychodynamic models of conversion disorder focus on the idea that people can be unconscious of certain perception and can be motivated to have certain symptoms. So, to its social and cultural factors, over the past century, there has been an apparent decrease in the incidence of conversion disorder, which suggests a possible role for social and cultural factors. So, during the 19th century, Freud and his colleague Charcot seemed to have an abundance of female patients with conversion disorder, but contemporary clinicians rarely see anyone with such problem. So studies shows that the diagnosis of hysteria has declined in Western societies such as the US and England but has remained more common in countries na may less emphasis lang on psychologizing distress but but has remained in countries such as in China and India. So during the World War One, a large number of men in combat developed as symptoms resembling sa conversion disorder. But by World War II, ang conversion disorder was less common sa mga soldiers na mga elite and whose subculture prohibited psychological expressions of distress. So support for the role of social and cultural factors also comes from studies showing na ang nagkakaroon lang daw ng conversion disorder or functional neurological symptom disorder are yung mga tao from the rural areas and yung mga people na may lower socio-economic status. Next, now, how to treat FNSD. So, the conversion disorder is a mental health condition that causes physical symptoms. Because of that, treating the mental health component with some form of psychotherapy is usually the first approach. The most common types of psychotherapy include cognitive behavioral therapy or CBT. This is the most common type of therapy recommended, and experts also considered it the most likely to work. The next is hypnotherapy. This is usually a second option for types of therapy. It may be especially helpful when the symptoms of conversion disorder affect your ability to speak or any of your senses. Group or family therapy naman are shared therapy experiences can help people with functional neurological symptom disorder. Itong group therapy can help people with this condition to connect with other people who have similar struggles. And itong family therapy naman can help yung mga mahal mo sa buhay to understand the condition and offer support. Kasi sabi ko nga kanina na mostly ang mga patients na nakaka-experience ng functional neurological symptom disorder feel so helpless. So itong family therapy can greatly help if may loved ones ka na nakaka-experience nito and to offer them support para they will feel hopeful na gagaling pa sila. So there are other treatments that may help include like physical therapy. The symptoms of conversion disorder may start with mental health but the physical effects are still real. Kasi nga 'di ba makaka-experience sila ng mga physical symptoms. So, physical therapy can help people with conversion disorder recover from or adapt to physical symptoms. Next is the medication. When conversion disorder happens alongside other conditions such as depression or anxiety, medications for those conditions can help the disorder symptom also. This is especially true when the conversion disorder causes pain symptoms as antidepressants can offer positively affect pain levels. Next is biofeedback. The biofeedback is an alternative medicine approach that teaches people to change the way their body functions. And it is a mind-body therapy that may improve your physical and your mental health. So, during ditong biofeedback session, may provider ka na gagamit ng monitoring equipment and instrument para ma-measure ang iyong body functions. So, based on the feedback from the instrument na ginamit, your provider will suggest you kung paano ka makakreate ng mga physiologic changes. And also with education and practice, you can learn naman to make those bodily changes without the use of equipment. So, there have been actually no psychological treatments that have reduced the symptoms of the functional neurological symptom disorder in controlled trials. Traditional long-term psychoanalysis, psychodynamic psychotherapy, and hypnosis have not been demonstrated to be useful with this disorder. So case studies suggest that it is usually not a good idea to try to convince people with this disorder that their symptoms are related to psychological factors. Rather, it is better na mag-offer ka lang ng gentle support. So, case studies also have suggested that reinforcing a person for being able to improve his or her functioning can be helpful. So that's it for the functional neurological symptom disorder. I hope you learned something. Then moving on to another disorder, which is still under somatic symptom and related disorder, factitious disorder. So for the intended learning outcomes, it is to understand the factitious disorder, identify its diagnostic criteria, identify its diagnostic features, identify the epidemiology of factitious disorder, to determine the etiology of factitious disorder, and to know the treatment of factitious disorder. For its topic outline, define factitious disorder, diagnostic criteria, diagnostic features, epidemiology, etiology, and treatment. Now, factitious disorder, it is a serious mental disorder in which someone deceives others by appearing sick or by purposely getting sick or by self-injury. Factitious disorder also can help when family members or caregivers falsely present others, such as children, as being ill or injured or impaired. Now, factitious disorder, it is a condition in which a person acts as if he or she has an illness, or by deliberately producing, feigning, or exaggerating symptoms. An individual fabricates or exaggerates physical or psychological symptoms because they enjoy being in the sick role. So these symptoms are being fake, but they might also be induced. So, ang mga taong may factitious disorder will go through great lengths such as pretending to be sick kasi gusto nila na they enjoy being in the sick role. For example, a person may take something or eat something to cause herself to vomit. And for example, a soldier with factitious disorder might exaggerate or invent something na meron daw siyang anxiety symptoms, not to avoid the combat, but for the attention na marireceive niya from the soldiers, from the other soldiers, or from the clinicians. So their role there is to deceive 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 themselves and deceive other people. So, whereas both malingering and factitious disorder involve deception, inventing or exaggerating symptoms, the motivations are different. Unlike those with malingering, ang mga tao na may factitious disorder do not deceive others, or hindi nila nililin lang ang other people for material gain or to avoid negative events, but to seek attention from other people. Ganon, yun siya. Now, the factitious disorder has two types. Factitious disorder or the Munchausen syndrome. It is different than malingering, or since it has other motivations. They injure themselves covertly, and they produce physical symptoms. Ang factitious disorder naman by proxy, they injured others in order to gain attention, just like mother hurting a child. So itong factitious disorder imposed by self, ito yung pinapaniwala mo ang ibang tao na may sakit ka kahit wala naman talaga. While itong factitious disorder naman imposed on another, or Munchausen syndrome by proxy, ito yung pinapaniwala mo ang kaibigan mo na may sakit, yung nanay mo, kasi nga gusto mo lang ng atensyon kahit wala naman talagang sakit ang kaibigan mo. Pinapaniwala mo lang na may sakit siya. So, the first type of factitious disorder, its diagnostic criteria: falsification of physical or psychological signs or symptoms, or induction of injury or disease associated with identified deception. The individual presents himself or herself to others as may sakit, impaired, or injured. Now, next is the deceptive behavior is evident even in the absence of obvious external rewards such as economic gain, avoiding legal responsibility, improving physical well-being. So the behavior is not better explained by other mental disorder such as delusional disorder or another psychotic disorder. So itong factitious disorder imposed on self, they are causing self-harm. They make themselves sick. For example, nag-inject sila sa kanilang sarili ng bacteria, milk, or gasoline, and they may injure, or like they will cut or burn themselves. They may take medications such as mga drugs for diabetes para mamimik nila yung other diseases. And then, ito namang factitious disorder imposed on another, the falsification or physical or psychological signs or symptoms or induction of injury or disease in another associated with identified deception. Next is the individual presents another individual, which is the victim, to others as ill, impaired, or injured. The deceptive behavior is evident even in the absence of obvious external rewards, and the behavior is not better explained by another mental disorder such as delusional disorder or another psychotic disorder. So ito yung when someone falsely claims that another person has physical or psychological signs or symptoms of illness or causes injury or disease in another person with the intention na linlangin yung other people. So I hope you understand the differences between the two types of factitious disorder. Then, to better understand, meron siyang diagnostic features. The essential features of uh, factitious disorder is the falsification of medical or psychological signs and symptoms in the individuals or others that are associated with the identified deception. So, individuals with factitious disorders can also seek treatment for themselves or another following induction of injury or diseases. So the diagnosis requires a demonstrating that the individuals is taking surreptitious actions to misrepresent, simulate, or cause signs over symptoms of illness or injury even in the absence of obvious external rewards. So the diagnosis of factitious disorder emphasizes the objective identification of falsification of signs and symptoms of illness and not the individual motivations of the falsifier. So, methods of illness falsification can include exaggeration, fabrication, simulation, and induction of injury associated with deception causes others to view such as individuals. So, ang mga tao daw na may factitious disorder might, for example, mag-report feelings of depression and suicidal thoughts or behavior following the death of a spouse despite that the death is not true or the individuals not having a spouse. And then deceptively report episodes of neurological symptoms such as seizures, dizziness, or blacking out. Next is minamanipulate nila ang lab test, for example, by adding blood to urine or to falsely indicate an abnormality. Then, they are falsifying the medical records to indicate an illness. Also, they ingest a substance, example, insulin or warfarin, to induce an abnormal lab result or illness. Then, they also physically injure themselves, like yung sinabi ko kanina na they are self-harming. So, like, sinusugatan nila ang sarili nila or they burn the part of their skin para lang magka physically injure sila because that is what they want. Parang gusto nila na nasa sick role sila lagi. So, let's move on to its epidemiology. 2/3 of patients with Munchausen syndrome are male. Then, ang status naman, they tend to be white, middle-aged, unemployed, unmarried, and without significant social or family attachment. And then, 20 to 40 years of age with a history of employment or education in nursing or a healthcare professional. So, sa age naman, it usually ranges from 4 to 79 years of age. Next, for its etiology, the exact cause of factitious disorder is not known, but researchers believe both biological and psychological factors play a role. Some theories suggest that a history of abuse or neglect as a child or a history of frequent illnesses in themselves or family members that required hospitalization may be mga factors in the development sa disorder. Now, how to treat factitious disorder. So the first goal of treatment is to change the person's behavior and reduce their misuse of medical resources. In the case of factitious disorder imposed on another, the main goal is to ensure the safety and protection of any real or potential victims. Kasi very delikado kapag ikaw ang mapiling biktima ng taong may factitious disorder kasi maaaring makakos talaga siya ng harm sa iyo. So, it's better na ensure the safety and protection sa maaring ma-victimize ng taong may factitious disorder. So the primary treatment for factitious disorder is psychotherapy. Then treatment likely will focus on changing the thinking and behavior of the individual with the disorder or the cognitive behavioral therapy. Family therapy may also help in teaching the family members not to reward or reinforce the behavior of the person with the disorder. So actually, there are no medications to actually treat factitious disorder. Medications may be used, however, to treat any related disorder such as ang depression or anxiety. So, in addition, most patients na may factitious disorder pala has histories of abuse, trauma, family dysfunction, social isolation, early chronic medical illness, or professional experience in healthcare. So that's it for factitious disorder. I hope you understand it, or you may ask questions and clarifications kung meron kayong hindi masyadong naintindihan. Now, moving on to other specified and unspecified somatic symptom and related disorder. So, number 1, brief somatic symptom disorder. Ito yung may duration ng symptom na less than 6 months. Same as with brief illness anxiety disorder. Ang duration ng symptoms is less than 6 months pa rin. And ang illness anxiety disorder without excessive health-related behaviors, the criterion D for illness anxiety disorder is not met. And itong pseudopsoriasis naman is a false belief of being pregnant that is associated with objective signs and reported symptoms of pregnancy. And then, sa unspecified somatic symptom-related disorder, this category applies to presentations in which symptoms characteristics of a somatic symptom and related disorder that cause clinically significant distress or impairment in social, occupational, or other important areas of functioning predominate but do not meet the criteria for any of the disorder in a somatic symptom and related disorders diagnostic class. The unspecified somatic symptoms or related disorder category should not be used unless there are decidedly unusual situation where there is insufficient information to make a more specific diagnosis. So that's it for my report. Thank you for listening, everyone. God bless.